Hello everyone, this is Marlene Robinson and welcome to my presentation entitled Patient Access to Their Electronic Health Record. With the advances in healthcare and technology, the electronic health record has emerged as the ideal system to organize the patient's health information, improve quality care, and promote the sharing of patient information between disciplines. Patients also have access to their record. However, the question is being asked whether they should have real-time access to all information in their electronic record, including the doctor's narrative notes. It's an ongoing debate with many pros and cons. In this paper, some of the pros will be presented. Advances in healthcare and technology over the past 3 decades continue to promote the implementation and use of the electronic health record. According to Sekman 2013, the electronic health record promotes patient safety, enhances quality care, reduces medication errors, organizes the patient's chart, cuts costs, and supports the sharing of information between healthcare professionals. By 2015, 78% of all health providers and 96% of all hospitals had the electronic health record system in place in compliance with the HITECH Act, which is called the Health Information Electronic for Economic and Cultural Health Act. The purpose of this paper is to defend the position that patients should have real-time access to all information in their electronic health records, including the narrative notes, and also to present some applicable laws and regulations. The first reason patients should be allowed to access the full electronic health record is this. It enhances patients' participation and empowers them to read and to understand and to participate in their care. For instance, they can go into their electronic health record at any time with any device to review the information. They can look at lab results, they could look at test results. If they had a procedure done, they could find out more information about exactly what was done. Patients also feel that doctors are too busy to answer all their questions when they come in for a visit. So in this way, they again would like to have access to their records so that they have an opportunity to review and even have questions ready when they go in to see the doctor. It helps to increase communication and facilitates the physician-patient relationship. When they get to the doctor's office, they now know what questions they want to ask. And in the event that they want to ask a question and they don't have an appointment, they can simply email the doctor or text the doctor to get information. They could also use the electronic health record to set up appointments. The doctor or his secretary can send out reminders for the patient. The EHR can also be used for patient teaching and patient education. All they would have to do is go to a certain part of the electronic health record to get that information. Studies show that patients were more comfortable in their office visits with their doctors when the doctors were able to share online information with them and allowed access to their electronic health record. Another reason is transparency. This increases the level of trust in in the patient's healthcare provider. They are not looking to, they're not looking in the charts for problems, but they are really looking to find out about themselves and to add any information that is missing, or if they see any duplications of test results or procedures, to bring it to the doctor's attention if it's necessary. According to the My Health eVet pilot program conducted by 9 VA hospitals in 2013, patients stated that it was a positive experience to access their entire electronic health record in spite of some of the derogative expressions noted in the record. The electronic health record also is a comprehensive tool compared to the electronic medical record, because the electronic health record includes the doctor's narratives, it includes information from other disciplines, which patients normally wouldn't have access to, but now they're able to see the interrelationship between uh, the doctors and other disciplines. It also enhances patient-centered quality care, and the electronic healthcare record is more comprehensive. It's organized and easy to use compared to the handwritten uh, record that we had years ago. State and federal regulations. There are several. In 1996, we have the HIPAA, which is the Health Insurance Portability and Accountability Act, which insists that patients' privacy and confidentiality should be protected and that there should be proper security measures in place when there has to be exchange of any information to prevent compromise. In 2009, the HITECH Act and the Recovery Reinvestment Acts, using the Meaningful Use Incentive Program, were able to give financial incentives to many organizations in order for them to adopt the electronic health record into their practice. In 2010, the Center for Medicaid and Medicare Services launched one of several incentives to also improve health access to the electronic health record. Again, in 2015, HITECH gave additional federal government monies as incentives for the electronic health record to be implemented by hospitals and primary physicians. And in April of 2021, the 21st Century Cures Act will become a law, with a provision that allows patients to electronically access all of their electronic healthcare information without cost. It also prohibits the blocking of access by providers to other providers. So in conclusion, patients will now have access to their entire electronic health record, including the narrative notes, effective April of 2021. Providers will no longer be able to block access to other providers, which will enhance the sharing of patient information and lead to better patient-centered care. And also, there's going to be improvement in the documentation by healthcare providers, because this record will be seen by everyone, and hopefully it will decrease unprofessional, derogatory entries on the electronic health record as noted previously by especially patients. Thank you for listening to my presentation. The next two slides will be references.